During the course of college, I had an epidemiology teacher. So I kind of caught the ideas real clearly of what he was talking about and thought at the time that would be really fun to do.
I'm an RN and I was working at a small community hospital in Ottumwa, Iowa. We had to attend an in-service with our new infection control nurse. I had a lot of questions that I asked, and the infection control nurse was very patient with me, but decided to let the others go, and she took me to coffee.
I was really fortunate to have a very long career from my college teacher straight on. I got a real love for epidemiology, for investigation, for research.
I think I was meant to be as far as infection prevention.
Finding infection prevention was actually an accident while I was looking for a hospital policy, and I just came across the department page. And unfortunately, I think that's how a lot of people find out about infection prevention, is by accident. It is the best career you've never heard of.
My background myself is public health. I'm not a nurse by background, and that's been career limiting for me. There's a general move to broadening and diversifying the workforce in infection prevention and not being so narrow to a clinician.
We must grow the profession in order to allow us to meet the scale and the demand from where we go from here. Today, we can't easily explain to an 18-year-old how you can become an IP. That has to change. One of the big areas that APIC has been invested in is what we're calling the IP academic pathway, which is our ability for us to actually help design and develop the next generation of IPs.
It's the first national effort to link defined university curriculum with the field of infection prevention and control. It's an intentional track to create certificate and degree programs that support building strong, competent infection preventionists and expanding our workforce, as we know, finding strong, competent infection preventionists becomes more and more difficult every year.
In essence, we're creating a career path, from education all the way to entry into the field and then career development from that point forward. And we're doing that in a few different ways. One of them is through creating a certification in infection prevention. We're also working on graduate degrees so that you can actually get a master's degree in infection prevention.
Our diversity is our strength. APIC is examining how to implement an organization-wide diversity, equity, and inclusion program that embraces infection prevention from the perspectives of race, ethnicity, gender, sexual orientation, age, as well as education, years in the field, practice setting, and CIC status.
APIC, starting last year in 2021, really began its journey around diversity, equity, and inclusion. And we're so proud of our efforts. We're in the very beginnings and have a long way to go. We're not looking at it just from a checking a box. This is something that becomes part of our DNA. And for us, that diversity of innovation, ideas, practices, backgrounds, races, ethnicities, genders, all of that is critical to us to make sure that we grow our profession to the next level. I often say that I feel like at APIC, I get to work for superheroes. Every day, they're out there making a difference and they're fighting the invisible battle. When you watch our IPs in action together, there's this dynamic that happens that while one IP plays a critical part, the power of many takes it to another level.